When Jennie and Nich Pollak hoped to add to their family, Jennie's doctor prescribed a low dose of a fertility-enhancing drug. After taking it for just 1 month, she and Nich were stunned with the results.
We had 12% chance of twins. We got an ultrasound and 3 sacs popped up, and then they were going to check the third one's heartbeat, and the 4th one came, so we were shocked.
The wider use of fertility-enhancing techniques and a rise in resulting pregnancy with multiples is one reason for an increase in premature births. Today, premature delivery occurs in 1 in every 8 live births in the U.S.
Premature birth is very common, and despite recent advances in treatment of premature babies, the obstetric management of preterm birth has really not given any advances.
At about 20 weeks, I was the size of a full-term pregnancy. At 22 weeks, we had a routine ultrasound, and my cervix was extremely short. It was just under a centimeter, and so they admitted me right away. The babies were born at 23 weeks, 1 day. Brennan was born first, and he was 1 pound 4 ounces. Landon was second, 1 pound 7. Caitlin was third at 1 pound 5, and Brooklyn was 1 pound 3.5 ounces.
The most common problem that premature babies have immediately after delivery is respiratory problems. The other problem is their brains aren't well developed, and so often they'll have developmental delays. They also can have problems with digestive system, with diseases that cause them to need surgery. And so there's a whole spectrum of problems. Premature birth is actually the major cause of infant mortality in the United States.
Tragically, Jennie and Nich lost daughter Caitlin when she was 3 days old. But the other babies grew and thrived with the support of the University of Michigan Neonatal Intensive Care Unit.
At the University of Michigan, there have been a number of developments. Techniques like high-frequency ventilation, liquid ventilation have been developed here, and then drugs that are often used both to give to the mother, but also to give to the newborn to prevent long-term brain damage, to improve lung function, are all techniques that have been developed or evaluated here at the University of Michigan.
After a nearly 8-month struggle, the last of the Pollak babies was recently discharged from the Neonatal Intensive Care Unit at C.S. Mott Children's Hospital, making this Father's Day a very special one, especially for stay-at-home dad Nich.
Both Brooklyn and Brennan are starting to hit developmental cues where they're supposed to be at, and just showing positive signs that they're going to catch up. And Landon's doing good too. We want the people at Mott to know that we're really appreciative of everything they've done. To just watch our baby start off 1 foot long and barely a pound, and to see him now at 12 and 15 pounds is amazing. This is the most special Father's Day ever, to actually have them home, be able to spend time with them and see them grow. It's just, I'm in awe of them, so it makes this Father's Day amazing.